So friends, the title of this oration is looking back at a year that changed the world. Looking back at a year that changed the world. And this one year has been a monumental year for all the people in the world. They have not seen, none have seen 1918 pandemic, but all of the people of the world now realize what pandemic is all about. A new entity, and it is COVID-19 pandemic. And it is not the last pandemic. There may be many pandemic in the days, years, and centuries to come. It shall be a reality for all of us in the world. None can ignore the reality of the pandemic from now onwards, whether it is government or citizens or organizations or businesses or agriculture or life. Anybody living on the planet shall have to live with the pandemic. Let us start with knowing the reality as on today in the world. And this data is a grim reality of what the world has faced. The world has faced more than 112 million infected individuals in the world in 1 year. This is the current situation from the WHO coronavirus disease dashboard. Out of 112 million, 28 million have been detected in USA. The most powerful, the most developed economy has faced the highest number of infections by any country in the world till date. And not very far behind is the second most populous country in the world, that is India. 11 million as compared to 28 million in USA. And Brazil in South America has faced more than 10 million infections during the year. Russia, again a very powerful country in the world in the geopolitical arena, has faced more than 4 million. But most surprising is this country, the United Kingdom, a very small country in Europe, but has faced more than 4 million infections during the last 1 year. And it is very near to Russia, which is a vast country if you see in terms of its geographical spread. So in this picture, what you see, it's a true pandemic. Northern America, South America, Europe, Asia, all continents have been affected. None has been able to stop the spread or start of the infection in their own country. So that's number one reality of the last 1 year. If pandemic strikes, the only solution is to face the reality. That's one. Second, if we know pandemic in terms of geographical spread, second reality we have to realize is to understand its impact on the population. After all, it's a human infection. So the second column is cases which are cumulative per 100,000 of population. In the world, if the global level is 1.4 million per 100,000 population, 1,446 per 100,000 population, the USA has been very, very gravely affected in terms of its population impact. Against a world average of 1446 per 100,000 population, USA had 8,490 infections. That is 4 times of the global average in terms of infections in human beings in the if we take the human population. Against that, Brazil has had 4,888, which is again 4 times or more than 3 times, 3.5 times of the global average. And if you look at the United Kingdom, 6,119 affected out of 100,000 population, which is 5 times of the global average. These are the 3 countries the human impact has been the highest in the world: Brazil, USA, and the United Kingdom. And to follow them was Russia. Imagine Russia, which is, if you look at the map of the world, Russia is so big, so large, yet its population has been affected gravely. 2,893 persons per 100,000 population have been affected. And against this, you look at the condition of India. If the global average is 1448, Indian cases cumulative per 100,000 population is only 802, which is 10% of the population infection in USA. If you look at the resources and the impact that India had, this is also a reality. That is number 2 reality. That it has not affected the human population equitably across the world. There is a country specific impact on human beings. That number 2 observation after 1 year of the infection of the pandemic. Now, let us see the reality of today. What has happened in last 7 days for that matter? Last 7 days, the global infections have been 2.6 million. Against that, USA had 473,000 infections in 7 days. And also Brazil is still having 359,000 infections in 1 week. And Russia is having 84,000, UK is having 71,000, India is also having 102,000 infections during this last 1 week. The crucial observation is the pandemic has not receded. It is still present across the world. Number 3 observation. Nobody can say it is gone. It is still present all across the world. So pandemic remains a pandemic as on date. Now look at the reality of today, the 4th column. The cases newly reporting in last 24 hours, which is the 5th column. In the last 24 hours, 432,000 infections were reported globally, out of which the maximum infections reported have been from USA and Brazil, 73,000 and 65,000. And India is number 3 in the world today. That is, it reported 16,000 infections in last 24 hours. Russia reported 11,000 and UK reported 9,995. What does it mean? The infection is present all across the continents as on date, and it has not gone away. So the 4 realities, 4 columns. Now, if we look at the impact in terms of deaths, they are the right side columns. How many people have laid down their lives during the last 1 year? This is the column on the 6th column on the right. Deaths cumulative total. It is 2,508,000 cumulative deaths, that is 25 lakh people, out of which 5 lakh people have been from USA. What does it mean? 20% of deaths have been in the most developed country, having the vast, most developed system of medical care and intensive care in the world, and highest per capita ratio of doctors and medical personnel. It has the one of the highest deaths in the world till date. 5 lakh, more than 5 lakh people, 5 lakh 4,000 people have lost their lives due to COVID-19 during the past 1 year. And Brazil, which is not that developed, it does not have that much of healthcare system, it has lost 2,51,000 during the last 1 year. And look at the ironical figure, again a very developed healthcare system in United Kingdom. 1,22,000 people have lost their lives due to COVID-19 during the past 1 year. So these three countries give you a bird eye view of the impact in terms of loss of lives. It does not bother about the developed healthcare system. It is something beyond medical care. That's the message on this column, cumulative deaths. It is not related to having a very advanced healthcare system present in your country. There is something more that you require to manage or contain deaths. The story should be much before deaths. Earlier I was talking about infections, now I'm talking of death. This is the journey from point 1 to point 2, from infection to disease to death. There's a long journey and a lot of intervention may be available. Yet it is not only the availability of an advanced healthcare system in your country which shall determine death or life. Now if you see in terms of population, deaths cumulative, there are 32 deaths per 100,000 population in the world, but against this USA had 152 deaths. Against 32 in the world, USA had 152 deaths, and Brazil had 118, and the highest in the world. The country which has the perfect universal healthcare national health system in UK, it has, the figure is 179 per 100,000 population deaths. Highest in the world in terms of population has been United Kingdom. And against that, if you measure in that column, India is the lowest, having only 11.37 deaths per 100,000 population. And mind you, deaths are recorded more correctly than any other parameter. Infection may be underreported, but deaths generally cannot be hidden. So against 179 per 100,000, India had 11.37. So you require more than healthcare to save lives. During the last 7 days, if you look at the deaths, 65,000 deaths have been reported. Against that, 15,000 deaths have been reported still in the last 7 days from USA. It is continuing to show its impact in USA. Such a vast country, not very high population, yet deaths have been still going on. 15,000 deaths in 7 days. And Brazil, 8,000 deaths in 7 days. Russia, 3,000 deaths 7 days. UK, 2,683 deaths in 7 days. And against this, you see, look at Indian figure, 700 deaths during the last 7 days. These are figures worth noting, and we are talking about a pandemic. It is not country specific figure which matters. It is the global figure segregated to countries which matters because it's a pandemic. And you must remember, the flights are still not normal. What will happen if the flights are restored to normal? You can imagine. This is the condition when flights have not been normal, inter-country migration has been contained tremendously, testing has been scaled up, yet you see the figure. Can the flights be opened? Can inter-country migration be opened? It's your own conclusion. to be drawn. During the last 24 hours, 10,773 deaths have been reported globally, out of which 3,000 deaths were from USA and 1,500 were from Brazil. So, North America and South America equally are facing the impact till today. Against that, if Russia were reporting 428 and UK reporting 323 deaths, India reported only 113 deaths in last 24 hours. So please remember, the infection has not gone away. The impact is continuing to happen all across the world and continents. It's a global reality. It's a true pandemic. It's not going to go away with so easily. Now we come to India. Has it changed India? Last 1 year, the world has changed. Has India changed? Does India know its reality? Let's see. We shall now go to the states from countries. We shall now go to the states of India. We had, as I told you earlier, 11.08 million cases, 1,56,000 deaths, and 1.56 lakh active cases. There are 1.56 lakh active cases still today in India. 16,000 cases reported last 24 hours, 109 deaths yesterday, 7.7 lakh tests yesterday, 7-day average test positivity was 1.97, which is double of what we had about 10 days back. Total cases growing at 0.13%, which is a positive figure. That means growth is still occurring. On the other side is 1.37 crore vaccination doses given to frontline workers and healthcare workers as the targeted population for phase 1 of vaccination. As from tomorrow, the new phase of vaccination of more than 60 years old individuals and people with 45 to 59 years of age having comorbidities shall be opened. So we shall see evolution of phase 2 of vaccination from tomorrow onwards. Keep a watch. This is today's figure for states in India in terms of, if you look at the top, for each parameter on the top, the state which is showing the highest is on the top, lowest is the bottom. So let's see the column of confirmed cases. Against 16,000 cases reported in India, Maharashtra is reported 8,333, Kerala has reported 3,671. So what does it mean? If 16,000 is the total infection, Maharashtra in the middle of the country, that is western coast, and Kerala at the southern coast have reported more than 12,000 cases. Out of 16,000, 12,000 have been in these two states, and Punjab, Karnataka, Tamil Nadu have followed. So it is still present across India, northern India, central India, southern India. It has not gone. If you look at the deaths, same figure is reflected here. Maharashtra remains at the top. Total deaths 109, Maharashtra reported 48. So more than 45-50% have been from Maharashtra. Punjab and Kerala follow with 15 and 14. So north, center, south still continuing to show deaths. Now look at the tests per million per day. Indian average is 571. Telangana is the highest. Delhi follows, and J&K and Kerala are the top 4 states testing for highest number of tests per million population per day. But Maharashtra is still lagging behind. It is showing 705 tests per million population per day, while actually it should be at the top. It is not. It is somewhere in the middle. So you see the gap in Maharashtra. 7-day average test positivity rate is still very high in Maharashtra and Kerala against the Indian average of 2.0%. Maharashtra has shown 9.6% test positivity percentage. Kerala has shown 6.1. Goa has shown 3.7, Chandigarh 2.6, and Punjab 2.4. These are the 5 states showing higher than Indian average in test positivity rate as on date. So again you see pan-India presence of infection during last 24 hours as well as 7 days. If you look at the 7-day average daily growth, Indian average is 0.13 as I told you earlier. Kerala is showing 0.36 and Maharashtra is showing 0.34. Punjab is showing 0.26. Chandigarh is showing 0.19 and Gujarat is showing 0.13. These are the 5 states showing 7-day average daily growth higher than Indian average. Again you see the reality. It is northern India, central India and southern India. It is growing and it is pan-India. Earlier I was showing you pan-world countries. This is I am showing you pan-India, the states. It is present all across the country, north, center, south. This is the story of active cases from last year to this year, today. 1 year story in one graph. If you go from left to right, general picture is you have been able to contain. But have you? If you focus only on the trend in the last graph on the right side at the bottom, is it going up or going down? The trend is it is going up. Somewhere in February and March middle, February, I'd say February middle, February first week to February last week, today 28th of February, it has gone sharply on the upswing. So, are we not seeing fresh infections? And questions are being raised whether are we seeing a variant or are we seeing a different kind of virus or different infectivity. Story shall roll out or revealed in the days and months to come. We shall know more. This is daily confirmed cases last full 1 year. From the left is the last 1 year back and right is today. But in the middle that you see somewhere in September we had reached the peak, but we are seeing an upswing at the bottom right again. So be on guard. This is Maharashtra graph. Does it reflect Indian graph? No, it does not. If you look at the bottom right, it is showing much sharper increase than the Indian graph which I had shown earlier. This is India graph, this is Maharashtra. So Maharashtra has to work harder. Amravati, Akola, these are the new hotspots in the country. Against the infections, we should see the testing. As cases rise again in the country, daily testing picks up speed once again and testing had fallen since January. So now it has started going up, but it is not at its peak. Maharashtra, Gujarat, Madhya Pradesh, Punjab, Chandigarh all seeing a resurgence of cases. Daily average cases and TPR has been on a consistent rise. These are reflecting on a national level trends. Testing is not catching up. It's important, cannot be overemphasized. Look at this picture. Amravati, 5,725 infections, Mumbai 5,948, Pune 7,211. So these 3 districts are all in Maharashtra, the highest. So from the state we are going to the districts now in this graph. Kozhikode in Kerala and Ernakulam in Kerala is still showing 3,500 infections in past 7 days. This is the geographical spread of vaccination. It is not even and it is not equal in terms of equity. More infections, more deaths, more vaccinations. It is not so as reflected in this graph. In Delhi, we have only had 20 vaccine doses given per 1,000 population so far. So in percentage it becomes 2% of 100. 2 out of 100 have got vaccinated. Jammu Kashmir also had 1.68, Himachal had 1.5 out of 100, Gujarat had 1.4, Kerala had 1.3, Chhattisgarh had 1.3, Uttarakhand had 1.3 and Odisha had 1.2. All have, the vaccination has been given to between 1 to 2% of the population. So we are far away from having a large vaccinated population, which shall be, you see in the now sudden increase from tomorrow onwards. India has crossed 12 million vaccine doses and sets to start phase 2 inoculation drive from tomorrow. At the bottom graph is showing you the global figure of inoculation or administration of vaccine or vaccination. Darker the color is the number. Darkest is US with 65 million, UK 18.5 million, Israel 7.6, Brazil has been 7.3, China has been 40.5, India has been 12.6. You see the diversity, and the entire Africa is entirely unvaccinated. Please look at this. We do not know when it's going to start. Though recently India gave some doses to Ghana through the COVAX facility of WHO, this is the reality. And we are talking about pandemic. It does not identify countries or continents or cities or villages or districts. It reaches everywhere it wants to. If you look at the trend, on the left side is the total vaccination in India. It is rising, but not at the trend it should have risen. On the right side is daily cases and vaccination in India. If you look at the figure from January to February, when it's January 13 started on the left, and last 2 days back, though it has gone up, but it's inconsistent. And also the dark figure in each graph is daily cases, and daily vaccination is a pink one. So you look at the trend, we still have to scale up in its true sense the vaccination in our country. Though it is picked up, it needs to pick up speed much faster if we have to contain the infection pan India. So I will now take you through another journey, which is this journey of resilience, of something which India has done and which is not known to many people. Actually, the crisis brings the best in our population or human endeavors. They pick up, innovations pick up. We get much more sturdier. We show much more diverse ways of tackling infections in our community. Could anybody put the this presentation away? It should come on the screen. That's what I want. The previous one has gone. I shall be taking you through broad headings under which innovations and human endeavor has shown what it can do during the last 1 year in our own country, that is India. First story is public health and clinical response. Government of India very agile way brought out guidelines and started rolling out all across the state. The kind of coordination that India has shown between the national, federal government and the states has been unseen ever in the last 70 years. The state government and central government have collaborated. If you look at integrated disease surveillance program was made use of. These are hidden stories which are not known to many people all across. Maharashtra, Pondicherry.
Dr. Jain, your slides are not visible. I mean visible but not readable. Number one. Number two, my request, please, you have to hurry up.
Yeah. Slides are not visible so clearly. I'm seeing them. Why is it? Yes, I think I'll read up rather instead of wasting our time on this. There'll be more better way. Containment zones and cluster management has been very effective all across the country during the last 1 year in India, which is I think each number of states have shown innovations in containment, in testing also. If you look at the way Indian government, all departments, all ministries and state government have come to get the testing on the ground, testing labs, testing way in which we have to actually test the people on an effective manner on the ground has been commendable. Goa, Gujarat, Jharkhand, UP, and Sikkim have been outstanding states which have shown home care. Could anybody could anybody think of home care being provided in India? It was not a model yet. Home care has become a reality today in India. Haryana was outstanding in its innovation on home care. Pulse oximeters being given at home. It was never thought of earlier. Quarantine and isolation management in Chhattisgarh have been outstanding. Boosting health infrastructure. Could anybody think that India could actually show this growth in boosting the health infrastructure? Gujarat, new hospital getting built up, new facilities coming up and duly manned. Case management, clinical guidelines and being developed by Uttar Pradesh and a number of other states have been outstanding. Awareness creation and behavior change. Could anybody imagine a country like India, we could reach in diverse languages, cultures, backgrounds, educational level, and it has happened. It has happened. Now people are much more aware than they were. People know. Only protection against misinformation is give correct official information and make it available all across. Production and distribution of medical supplies, outstanding way India has scaled up its own production for its own people, and then from there it went on to giving aid of these medical supplies all across the world. Unimaginable. People never knew that India could do it. Medical waste management guidelines by CPCB and state governments implementing in its own innovative ways. Then delivery of essential services, capacity building and welfare of health workforce. It has happened. The training, the way innovative ways in which national governments and state governments in actually implemented the training was outstanding. Governance mechanisms have changed, which was not thought of. Would state governments with weak governance infrastructure also performed very well? Jammu Kashmir, amazing how control rooms were set up and contact tracing, containment officials in a very disturbed state. Jammu Kashmir, Kerala, Gujarat, it happened. Pondicherry, Sikkim. Then another outstanding feature India had done was digital health guidelines and domestic travel, air travel, telemedicine practice guidelines. None of them were in place. It got issued in a day and telemedicine became a reality. Teleconsultation became a reality. Video calling became a reality. WhatsApp use became a reality within no time. And it was used all across the country in multiple cities and towns. Another outstanding achievement that India had in the last 1 year was integrated model. State, center, district and municipal corporations and gram panchayats together, showing their act together, which was never seen, never imagined. We always talk about negative aspects of India. There are so many positives. I shall also mention the positive aspect of welfare of migrant workers and other vulnerable groups. Could people imagine 500 rupees being transferred to the bank for 6 months, every month on the go? Crores of accounts had positive balance, and I know individuals who got the money, who made use of that money. Not only money, ration, also LPG gas cylinders, food grains were given, which were not visualized that India could deliver. with this speed the way India delivered during the last 1 year. So we need to record, share the positive stories so that people who could not innovate get encouraged to innovate to be effective on the ground. And this has to be scaled up at the global level, because India is now at not only present in India, it's present in WHO, it's present in international bodies in a big way. So India is using its best practices in COVID-19 for international diplomacy. India is a member of Security Council, and please remember, United Nations, Security Council, WHO, ILO shall be the largest funding agency or mechanism through which pandemics can be managed. It is the only mechanism through which pandemics can be managed. And India has shown its leadership capability and its effectiveness in taking the leadership. So, has India changed? Has the world changed in the last 1 year? It has. It has changed the power equations. It has changed the global reality for all of us to understand. Now, the way forward is to continue to manage, continue to take up leadership roles in the districts, states, country, and the world. We should not pull down ourselves, we should keep our head up and guide the people around, the state, the country, and the world. That is the only way forward if we have to manage pandemic, the current pandemic, and pandemics that are going to come in future. I'm again grateful to IUH Delhi or AUHD to confer this oration to me. I'm grateful for the attention of the audience online and offline, for the time and attention given. Thank you so much.